Hello, my name is Claire Williams. I am the UK Sales Director for the Institute Hyalual. The following video is a presentation by Dr. Daniel's sister. In this video, Dr. Daniel's sister showcases his PRP Dracula therapy. In January 2017, Dr. Daniel's sister did a 14-participant case study looking at the combination of PRP with Institute Hyalual's product Xela Rederm. Xela Rederm is a combination of non-cross-linked high molecular weight hyaluronic acid with succinic acid. During this study, participants were treated to half of the face with PRP alone and the other half with the combination of PRP and Xela Rederm. Different factors of skin health were looked at. We looked at hydration, pigmentation, erythema and collagen and elastin stimulation. The study showed that on the half of the face that was treated with PRP and Xela Rederm, every single participant had a much better outcome in terms of skin health from the side that was treated with the combination. The following video showcases his techniques and also discusses the combination of this treatment. If you would like any more information about the treatment or any more information about Hyalual, please visit www.hyalual.com. I hope you find the following presentation informative and useful, and please enjoy it, and any feedback would be gratefully received. Thank you.
My name is Dr. Sister, and I'm going to talk about the platelet-rich plasma. Platelet-rich plasma is not a new treatment. It was discovered in 1953 by two researchers who got a Nobel Prize for that in 1986. At that time, they discovered 2 growth factors. Today, we know over 30 growth factors in the plasma. Originally, they got a Nobel Prize, and the first medical study was published in 1970. When we do research online now, there is over 30,000 studies published on the subject for all different types of indication. Skin rejuvenation, hair loss, tendon, ligaments, veterinary medicine, sports medicine, even eye surgery, vocal cords, a lot of different indication. And because it's based on the patient's plasma and there is no risk, we can mix it either with fat or not mix it. It can be used with needle, with cannulas. It can be used after laser or not on its own. It's the most versatile and safe treatment that we have so far. The procedure itself is very simple. We need to take blood from the patient. That blood will be centrifuged for a specific time at a specific speed that will separate the plasma and the red cells. The plasma then will be harvested in a specific way again, and the plasma, when harvested, contains the growth factors and also a little buffer with the pre-stem cells. That will be re-injected all over the face if we treat the face, but it could be for neck, hands, elbows, wherever we need it. Originally, it was called, or it is still called, platelet-rich plasma, because when we centrifuge the blood, there is one fraction with the red cells, another fraction just on top of it, which is called the platelet-rich plasma, because it contains most of the platelets, and then another fraction called the platelet-poor plasma, contains less platelets. But new studies show that even the platelet-poor plasma is interesting, containing other chemokines, cytokines, so there is no point of using only the rich fraction. It's better to use the whole of the plasma, meaning also that we need the whole blood and more than 10 cc. So we have a specific tube with 20 ml, which will give us 10 ml roughly of plasma, rich and poor. That will be used then, once activated with calcium, at the last minute to be injected all over the skin. So first we're going to inject around the eyes, deep, in contact with the periosteum. Then on the jawline, again deep contact to the periosteum, 0.2 ml each time at each injection, and then on the nasolabial. At the end, we will use the remaining of the plasma on a gauze and we'll dab it all over the face. First advantage, it will penetrate through the tiny injuries or the tiny opening from the needle, give more benefits. B, it will act as a disinfectant, as the plasma is also microbicidal, therefore it will clean and help to tighten the skin. That's the procedure itself. So we go first deep, then medium deep, then intradermal, and then superficially on the skin. In the kit we use, which is a specific kit for this treatment, everything is included inside. In the box we have the total kit, meaning the butterfly, the 20 ml syringe, the anticoagulant to take the blood. When that is done, then the blood is inserted in a specific tube, 20 ml, where there is no chemical separation, spin for 8 minutes, the centrifuge is preset. The plasma is harvested then with the same syringe, and we have, again, in that box, the tube to harvest the plasma, the syringe, a 1 ml syringe just to inject, because it's easier with 1 ml than with a bigger syringe. And we have also a 5 ml syringe that is very useful if we want to mix whatever of the plasma is left with hyaluronic acid, succinic acid, whatever. There is also a two-way connector inside, which makes things easy. Here is a box containing everything that is needed for one treatment, one patient. We have 3 packages inside. The first one is used to take the blood that contain the butterfly and the syringe. The second one is a specific kit and other syringe we will need for the treatment, and 1 ampulla of anticoagulant and 1 of calcium to activate it at the end. So first we're going to take some anticoagulant, and just prior to injecting we're going to use the calcium. We have a 20 ml syringe, the butterfly, 2 caps that will be used at the end, and a needle. The anticoagulant is a 5 ml ampulla, and we just take half of it. We don't need more than that. The butterfly is then fixed and we're ready to take some blood. As I said before, we need the anticoagulant before taking the blood, so it will not make a gel in the centrifuge in next 8 minutes. But if we want to treat a wound, if we want to treat a burn, then we don't use the anticoagulant. We would have a gel that will not be injected but spread on the wound and then dress. So if we treat a wound, no anticoagulant. Skin rejuvenation, anticoagulant. The second packet is what is really needed for the treatment itself. So we have the specific tube to harvest the plasma in general. It's a 20 ml tube and there is no chemical separation. We have a 10 ml syringe to harvest the plasma. That's the one that will contain the calcium. We have a 1 ml syringe that will be used for injecting, and we can use usually a 30J needles. Also, a 5 ml syringes that is useful if we want to mix it with another product. And we have a two-way connector. There is also 2 needles. One is orange, one is green, that will be used to insert blood in the tube. In the tube, there are 4 holes. The orange goes in one hole, the green one in the other one. The orange got a filter, the green doesn't. We will insert the blood through the green one. Therefore, the air which is in the tube will be expelled through the orange one. The calcium, which is the activator, that will be inserted in the plasma at the last minute prior to injecting. So we have a 10 ml syringe that will be used to harvest the plasma, a 1 ml syringe that will be used to inject, two-way connector connected to the other syringe that will contain the plasma. The blood goes into the green syringe. It can't go in the orange because there is a filter on top of it, and the blood is slowly injected into the tube. It had to be slowly in order not to damage the platelets. Then we remove the little white cap will be fixed on top here. Blood is spin to mix it with anticoagulant. Centrifuge is a medical grade centrifuge. Everything is preset. You put the blood, the tube with the blood, in one of the holes in the rotor. Never forget to put a counterweight with the same amount of water directly opposite to the blood. Centrifuge is preset for 8 minutes and the correct speed. The small vial is a calcium activator that has to be mixed with the plasma just prior to inject. And we take the whole of the calcium. The 10 ml syringe with the calcium activator will be fixed on top of the tube. Rear lock, you just turn it, and then we just press down to harvest the plasma and not any red cells, as the whole process is to take only the plasma, not the red cells. Untwist it, and here it is. Then with the 1 ml syringe, we take some of the plasma. So, first we're going to do under the eyes. Pull the skin, place your needle, and you push it until you feel the periostum. Inject 0.2. And again, and again. And it's spread all around. Then for the nasolabial, the needle again goes deeper than with a filler, more 45 degrees than 30 degrees. For the jawline, pinch the skin, pull and inject perpendicular, again to the jawline, to the periostum. Don't try to penetrate the bone, it's just contact. Sometimes patients lose volume also in the temporal area. She's not her case, but we would go from the hairline, put just 0.3 ml here. We could do the upper eyelid if needed. That will be part of the training. This video is just a demonstration and is not meant to replace a proper training. Now we go intramuscular. 0.2 each time, 4 or 5 injections. Injecting in the muscle, sternocleidomastoid, 0.2 each time. The platysma, and on the forehead, which obviously will be more superficial because you can't go really deep there. Then we finish by superficially injecting mesotherapy style. At the same time, I'm rubbing with my glove, not with gauze, so it penetrates through the skin. It can be done like that, or it can be done with a derma roller, derma pen, whatever other device you wish to use. And you cover the whole face and rubbing it . Whatever is left of the plasma on a gauze, just dab it on the skin. That will penetrate, clean at the same time, disinfect, and here is one side done. I'm going to demonstrate to you how you can mix it with another product. Syringe with the plasma, the two-way connector, and the other product. I like to use a mix of succinic acid and hyaluronic acid. I've done a study showing that by mixing the plasma with hyaluronic and succinic acid, I got an improvement on elasticity, hydration, redness, and pigmentation starting in the first week. So it's a very fast process. Study was conducted over 15 patients, and all of them had the same result within a week. So you just fix it with a two-way connector, and you just move it 10 times. So we've done nasolabial, we've done the jawline, under eyes. The same process basically is repeated from left to right or right to left. Little bump will disappear within the next few minutes. And that nice patient is ready to go to work.
On behalf of Institute Hyalual, I would like to thank you for your attention. I hope you found it useful and informative. If you would like any more information about the video that you have just watched, or would like more information on Dr. Daniel's sister's training courses, or even a copy of his case study, please email info@hyalual.co.uk and we'll be happy to deal with your request. Thank you very much for your attention.